It's informative. It's healthy. And it's the news. Welcome to the Health Connection.
Welcome to this month's Health Connection, Project DARE, Ending HIV Health Disparities.
Hello, everyone. Thank you for tuning in. Welcome to another episode of the Health Connection. I am your host, Kashai Martin, Health Promotion Peer Navigator for Care Resource. I'd like to start by wishing all of you a happy 2022, as well as acknowledge Black History Month and National Black HIV/AIDS Awareness Day, which took place on February 7th. Today's episode is about Project DARE, Ending HIV Health Disparities. My guest today has made significant contributions in the support and care for those living with HIV. Welcome back to the show, Melvin. Please tell us a little bit more about you.
Well, it's a pleasure being back. Thank you for having me once again. My name is Melvin Fort. I am the Access and Retention Supervisor for Project DARE. I have been working with Care Resource and in the field of HIV prevention for about 11 years now, a little over 11 years. So I have been baptized and received all of my stripes. Been on the ground, just building relationships, and I'm excited about the work that we're doing with Project DARE.
Well, as usual, it's good to have you back, and I want us to get right into it. What is Project DARE?
So Project DARE really is a new way of having conversations with our clients who are struggling with achieving viral suppression. We are excited about being funded under the Merck Foundation for this 5-year grant. We're in our second year of Project DARE. DARE is an acronym, stands for Disparities in Care, Disparities in Care, Addressed through Access, Retention, and Equity.
Wow.
This project aims to reduce disparities in access and retention and care. We know that clients are struggling with things outside of just taking their medication and coming to their doctor visits. So this new conversation that we want to have with our clients is what's happening outside of the medical setting. What's going on in your life? Because we know that HIV is a very small part of who we are. There's a large individual that's standing before us that we are assisting, and we want to know all about who they are so that we can assist the entire person.
All right. Well, I'm glad that this initiative is something for those who are living with HIV. The support is always needed and is much appreciated, I'm sure. So what are some things that we can expect from Project DARE in 2022?
I'm excited about the new conversations that we're having with our clients, really being able to kind of move away from, are you taking your pills and coming to your doctor visits, and more about, okay, so what's going on in your life outside of this setting? What's happening at home? And really diving deep into trying to figure out what these clients are challenged with, because these challenges are preventing them from accessing care continually. So having to address certain disparities, barriers to care, and be able to recognize, how we were able to move through these challenges that the clients are facing and still retain the client in care. So we're excited about and looking at where the project is going to land this year. We have currently enrolled, we have over about 71 participants currently enrolled in Project DARE. We are hoping to achieve at least 100 clients enrolled in the project by the end of this calendar year. Obviously, the goal is, again, to be able to recognize and address those social determinants that are preventing clients from accessing and retention in care. So we are developing our community relationships with our partners, developing other resources that are needed for participants' engagement in care, to retain their engagement in care. So we are continuing to develop those relationships and source out other resources that are fundamental for these clients.
Absolutely. Earlier, you mentioned that you had been doing this work for 11 years. So first, I want to congratulate you on making it this far in the work. It's very demanding. So what motivates you to continue moving forward?
It's a personal, it's very personal for me. I have been living with HIV since 1996. And being able to see myself in others and understand that I'm just a stone throw away from experiencing some of the things that I hear from our participants of the project. So I think that from that perspective, it gives me more of an insight, because I have personal experiences with navigating my own self through this healthcare continuum. There are a number of hurdles that one has to jump over. There's a lot of information that could be that's given to individuals who are HIV positive, and at times it could be a little bit overwhelming. So it's a personal investment for me, if I could say investment. And then I'm just passionate about, helping others. I really am. I see myself in others in ways that it helps me understand their situation a little bit better. So I've lived and was born and raised here in Miami-Dade County, very familiar with the lay of the land. So some of the familiar places that I find myself going to meet clients, it's just like going to my own backyard. I'm just going out to meet, friends and family of my community. So I feel very honored, and I thank the participants continuously for allowing me to be a part of the process with them, because it is an honor to go through some of the challenges that our clients are faced with. To be able to walk through that with them is an honor for me.
Oh, thank you for sharing, because I know having that background and having that common ground, that familiarity, I think that not only enables you to have compassion for the clients, but I feel like they're better able to connect with you because you come from the same background. And speaking of connections, if someone's a client here at Care Resource or they're not enrolled into care, how does one connect to your project?
So we often receive referrals. We work with our community partners, and we receive referrals for clients who they feel would work best with Project DARE. We obviously work diligently to identify clients just from our own client base within Care Resource. And that has given us a wealth of pool to pull from. The need is there. The clients are there with those needs. So it's not that we have to go very far to search for individuals who would benefit from this project.
Awesome. Now, one final question. Are there any pointers or any final words that you would love to impart on all of us in regards to Project DARE? I mean, this is a very great project, and we look forward to seeing how it can support those in South Florida. But is there any I don't know, words of wisdom or any hope or mission that you have in relation to Project DARE?
So we have finally reached a benchmark in the project that we were able to now get feedback from our participants. So we recently conducted our focus groups with our target pilot of participants in the project. They went through one-on-one interviews, individual interviews to provide their feedback, and then we had an open forum focus group. And the feedback that we've received, not just from the focus groups, just from an ongoing contact with our participants is that this project is really making a big difference in their lives. And they're very grateful for the additional support, sometimes it's just needing somebody just to reach out to and know that they're going to pick up the phone, because oftentimes the phone goes unanswered. So just barely, being able to just pick up the phone and feel good about that someone else is connecting with you seems to make a big difference for our participants. So I have nothing but, I'm very optimistic. I know that this project DARE is going to continue to impact participants and clients of the agency and in our community. I look forward to see how this is going to roll out to impact our community partners, the way that we conduct business, not just internally within Care Resource, but externally with other CBOs and the health department, and being able to kind of share this information and see how we can continue to address the goal of getting to zero.
Flawless, awesome. So, how can someone get in contact with you, Melvin? Someone who's interested in Project DARE, or in general, just the services that you do provide?
I can be reached through careresource.org. My direct email is mefort@careresource.org, or you can contact me through the call center, which is 305-576-1234, and my extension is 231.
Awesome, Melvin. Thank you again for not only promoting Project DARE, but returning to the Health Connection. You are always welcome here to speak with whatever you're working on. We really appreciate your company. Today's episode, again, was Project DARE, Ending HIV Health Disparities. This is Kishai Martin, your host, and we look forward to seeing you back here again on the Health Connection. Thank you all for watching, and have a great day.
Bye, you guys.
Don't forget to like us on Facebook at facebook.com/Care Resource, or follow us on Twitter at Care Resource FL, or subscribe at youtube.com/Care Resource. For more information or to find a location near you, visit us online at careresource.org.